Joining us now is Dr. Robert Michler, Surgeon-in-Chief at Montefiore Einstein Heart Center here in New York. Did I get your name right?
Yes, you did.
I'm so glad.
Yeah.
Can we do Stent 101?
We certainly can.
Because we've heard Stent for the last 24 hours.
Yeah.
A lot of people who have had the procedure know what it is. We have one right here in the studio. This is it, right?
That's it.
And what does it do exactly?
So the stent is a wire mesh, and it can be treated with a special agent to reduce inflammation. And that stent will enter the artery in the heart,
Right.
and with a balloon be dilated inside of that blood vessel to expand, and as a result of that, to stent open
Right.
the blood vessel.
Let me just show the audience, because take that shot again right here. It's very springy.
Yes,
Right. So it's very sort of pliable, right?
indeed.
So you go in, you blow it up, it opens up that artery. How long is it going to last then?
Well, that's an excellent question, because that is the primary concern with any stent procedure. There is an incidence of restenosis, and that incidence can be anywhere from about 10 to 30% at 1 year.
Right. So this is not, just because this is done, just because Bill Clinton is going home today and is going to resume his hectic schedule, that doesn't mean he's out of the woods.
Well, it doesn't. And this is where it's important for all patients who have heart disease to understand that what they really have is a disease. The disease is progressive, and as a result of that, the disease can come back and produce effects.
Because he had quadruple heart bypass surgery in his 50s, he's in his early 60s. He's a relatively young man to be going through as extensive a number of procedures as he is. Would you not agree?
Well, I do agree, but we also need to understand that heart disease is this nation's #1 killer. It kills more people than the next 7 leading causes of death added together. So this is an enormous problem. What's also wonderful to know that this problem is extremely well managed, and that great innovations have developed in the field of heart care to allow people to recover.
If managed correctly, I think is the question on both the doctor's standpoint and the patient's standpoint. The other thing, though, over the years, I cannot tell you how many segments we have done on this program about stents, about treating them, untreated, about their the level at which they're actually effective versus people who didn't have stents. Is this really the answer?
Well, it's not the final answer, Harry. I think that what we know is that bypass surgery, as former President Clinton had, is the gold standard therapy to prolong survival, to improve symptoms, and to reduce the risk of repeat procedures. Stents are used for very specific reasons.
And very quickly, you're surprised he's going home already today?
I'm not surprised at all.
That's weird.
He's in great hands at a great medical center.
All right, Dr. Michler, thank you very much. Do appreciate it.